unpointed Addison's disease, which is the deficiency of the adrenocorticoid secretions, which include the glucocorticoids, mineralocorticoids, and androgens. And I quickly put the functions of these hormones. So the glucocorticoids, which include cortisol, influence your body's ability to convert food fuels into energy, plays a role in your immune system's inflammatory response, and helps your body's response to stress. Mineralocorticoids, including aldosterone, maintain your body's balance of sodium and potassium to keep your blood pressure normal. Androgens, these male sex hormones, are produced in small amounts by the adrenal glands in both men and women. They cause sexual development in man and influence muscle mass, libido, and sense of well-being in both men and women. Some of the causes, the most prevalent one is an autoimmune response, where the adrenal tissue is destroyed by own person's antibodies. Other causes are it can be part of the polyendocrine deficiency syndrome, TB, infarction, fungal infection, AIDS, metastatic cancer. It can also be an iatrogenic Addison's, which comes from adrenal hemorrhage, often related to anticoagulant therapy or bilateral adrenalectomy. Some of the clinical manifestations are very slow onset and well advanced before diagnosis is made, because they don't show up until 90% of the adrenal is destroyed. Manifestations include fatigue, anorexia, skin hyperpigmentation, especially on sunlit exposed areas, orthostatic hypotension, hyponatremia, which induces the person to crave salt, hyperkalemia, nausea and vomiting, and diarrhea. One of the complications of Addison's disease is the Addisonian crisis, which is a life-threatening emergency caused by the insufficient adrenocortical hormones or a sudden decrease in the hormones. It can be triggered by 4 things: stress, sudden withdrawal of hormone therapy, after adrenal surgery, or following sudden pituitary distress. Some of the manifestations of Addisonian crisis are hypotension, particularly postural, which can lead to shock, tachycardia, dehydration, hyponatremia, hyperkalemia, hypoglycemia, fever, weakness, confusion, severe vomiting, diarrhea, and abdomen pain. Some of the diagnostic studies that can be made are checking the cortisol level with the ACTH stimulation test, which would show lower levels of the cortisol. Other lab findings include hyperkalemia, hypochloremia, hyponatremia, hypoglycemia, anemia, increased BUN levels. And you can also check the urine levels, and it would reveal that the cortisol and aldo are low. Also in the ECG, you would see low voltage due to hyperkalemia. CT scans and MRI are also made to check out the localized tumors or identify adrenal calcifications or enlargement. Some of the treatment, the collaborative care, which just includes the management of underlying cause. It includes replacing the therapy, which hydrocortisone. On high stress situations, you have to administer glucocortisone dosage. Also administer mineralocorticoid steroid daily, and also this person needs to increase salt in the. Some of the acute interventions include checking vital signs and symptoms of hypovolemia and electrolyte imbalance every 30 minutes to 4 hours, daily weights, corticosteroid administer, protection from environment stressors, which include noise, light, extreme temperatures, and against infections. And also assist the person with the daily hygiene, including AD. Some of the ambulatory and home care. So the dosing schedule reflects the normal body circadian rhythm. In this way, it decreases the side effects. So the glucocorticoids, 2/3 of it is dosage in the morning and 1/3 in the afternoon. Mineralocorticoids given once, usually in the morning. Stress management is important to this patient, and adjustment of the corticosteroid levels in times of stress. Notify the doctor if nausea and vomiting occurs. Educate the the patient of the signs and symptoms of Cushing syndrome, wear a medic bracelet stating disease. Patients should also carry an emergency kit with treatment, educate IM injection administration to patient or significant other in case oral route doesn't work.